Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Aradhya Achuri from Apollo Cradle and Children's Hospital. She's going to talk about National Sexual and Reproductive Awareness Day. So stick around until the end and ask us question if you have any. Doctor, you can continue.
Hello everybody, I'm Dr. Aradhya Yachuri from Apollo Fertility Kodapur. Today I'm going to be talking about a very important topic which is sexual and reproductive health awareness. Every year on Feb 12th, we celebrate Sexual and Reproductive Health Awareness Day. This day gives us a chance to promote knowledge about issues related to sexual and reproductive health as well as prevention of sexually transmitted infections. Why is it important? Because when you are healthy, your partner will also be healthy. Healthy me as well as healthy we. Sexual health issues should be highlighted from puberty to menopause. Unfortunately, in our society, sexual health is something which is very rarely talked about. Learning about the use of various forms of contraception, how to protect yourself from sexually transmitted infections, how to lead a healthy and comfortable sexual life is very essential. Several programs have been introduced under Reproductive Maternal Newborn Child and Adolescent Health by the Ministry of Health and Family Welfare of Government of India. So today we'll utilize this opportunity to talk about sexual health. How can you contribute? What do you need to do to be sexually healthy? Have exercise of at least 30 minutes every day to release endorphins, which are the feel good hormones. This will improve both the men and women's overall sexual performance. Ensure proper personal hygiene. This includes uh, micturition, which is passing urine before and after having a sexual intercourse, taking proper care to clean your genitalia, using proper contraceptive barrier for the men, and of course an oral contraceptive pill for the women. Eat a wholesome, balanced diet, get enough sleep. Manage stress by getting medical advice and take supplements as advised by the physician. If you engage in sexual activity, being tested for sexually transmitted infections is strongly advised. Receiving routine laboratory tests is a standard procedure to maintain good sexual hygiene even if you are regularly using condoms. A beneficial habit for sexually active women is annual cervical screening for cervical cancer, which is a pap smear. It hardly takes 2 to 3 minutes. It is very non-invasive, doesn't cause any pain, but it will give you a lot of help in case you are diagnosed with some infection or if you have a precursor for cancer. This test will ideally diagnose any issues in your cervical health and let you get it treated initially earlier before it converts into cancer. Even if you don't have any symptoms, you should still get these tests because most sexually transmitted infections do not have any symptoms. Now let's talk about contraception. I'm sure many people don't realize that there is a chance of pregnancy even after using condom. Especially condom failure can occur when the package is not stored properly. If it is incorrectly put on, if it is an expired condom, if it's a torn or damaged condom, it doesn't fit properly, either it is too small or too large. Using it with the wrong type of lubricants. All of this will increase the chance of conception even if you are using condom. So educate yourself properly before you use a condom and make sure you are following all the guidelines on how to use a condom. And many people think that I pill is the solution for having an intercourse when you're not planning pregnancy. It is not. It should be used only for emergency. It is a high dose progesterone hormone pill and it can cause a lot of hormonal imbalance. So many people ask how many times can I take it in a month? Ideally, you should not be using it, and if you have to use it, I feel should not be taken more than once or twice in a year. If you are somebody who is regularly having intercourse, go for a barrier contraception like condom along with oral contraceptive, which is a 21-day pill. IPIL should be used only in case of emergency, like the condom has broken, or you realize that there has been some spillage, or you missed your 21 days pill, one or two pills, and you don't want to take any risk. IPIL should not be consumed in a routine way. Using 21 days of oral contraceptive pill along with condoms is the best way to avoid pregnancy as well as sexually transmitted infections. And IPIL cannot cause abortion, it can only avoid pregnancy. So, if you have taken it later on, like after 3 or 4 days, you are still at risk of having pregnancy after using IPIL. In case of an unplanned pregnancy, when you are contemplating abortion or medical termination of pregnancy, always do it under the guidance of a doctor. It may seem scary or uncomfortable to go to a doctor in some instances, but is very, very important for your reproductive health later on. If you're somebody with negative blood group and your partner is positive blood group, like the girl is O negative and the partner is A positive, you need to take anti-D injections to prevent complications in your next pregnancy. If your pregnancy is in the tubes and was not diagnosed because you didn't see a doctor, you may end up in a critical situation and may require laparoscopy. If your abortion was not complete and it was not diagnosed, it can lead to infection. It can lead to scarring of uterus. It may hamper pregnancy later on when you are actually planning pregnancy. So always consult a doctor instead of going to your local medical shop and popping some pills. If you're negligent today, you may land up in trouble tomorrow. So take care of your physical, mental, and sexual health for a healthy life. Thank you. If you have any doubts, please message in the chat and we can answer your queries.